So I'm going to ask Sherry, open, please. And we're just going to check in here and make sure we don't see anything like a red mark or white or bumps. We check her cheeks. See, Sherry has like a bite mark on her cheek. She must have bit herself. And we go around. And this side here looks like Sherry might be a cheek biter. And then we ask Sherry, stick out your tongue, please. So we check underneath the tongue like this. And you have to check the other side. And then I'm going to grab my instrument, my mirror, and I'm going to look down Sherry's throat. So we look all the way down in here to make sure we don't see any red areas or whitish areas. And then I feel on her palate. And I check her cheeks for bumps. Check down below under her tongue. Okay. And then we have different instruments for different places, but then I'm going to take my Explorer and I go around all her cracks of her fillings and make sure there's no sticky areas. So if you're pursuing a hygiene career, it's a great career to be in. It's a great career if you're a mother and you only want to work certain days, like maybe 3 days a week, or, you know, and then you're home for your children. So Sherry looks good. Sherry looks like she brushes her teeth a lot and flosses a lot. So it looks like Sherry doesn't have any cavities today. But the doctor will come in at the end and give her an exam and make sure that everything looks okay for the next 6 months. In all the areas with these back molars, you take this, people call it a scraper, but it's actually a scaler. And you're going to go around each tooth like this. And you're going to make sure you don't feel anything that's hard underneath of the gum. And then you just go around like this.
And what is the purpose of that thing?
This here is taking the plaque and calculus, which is the hard deposit on a tooth. It's removing all the bacteria from around the tooth. And it's not hurting Sherry. If you see a little bit of blood, it's not hurting Sherry. It's just that the instrument goes below the gum line and then just, you know, just causes a little bit of bleeding, but it's a normal thing. It's not like Sherry doesn't have good hygiene, because she does have good hygiene. But there's a lot of procedures that you need to know. You need to know, like CPR. You know, you have to be updated on all OSHA regulations. That's the cleanliness of the office and keeping the patient safe. So you have to have training for that every year. You have to have certification for CPR every couple years.
You have to keep